When the client arrives at the practice for their appointment, direct them to the feline waiting area. If possible, the cat carrier should always be placed on an elevated surface, not on the floor. If the cat's fearful or stressed, offer a towel sprayed with synthetic feline facial pheromone to cover the carrier, which may help calm the cat. Show the client into the exam room as soon as possible so the cat encounters minimal human and animal traffic in the waiting area. The veterinary team should always greet both the client and their cat calmly, softly, and warmly. The key at this point is to remain flexible as to how the appointment will go.
When I come into a room to examine a cat, I haven't made up my mind about how that experience is going to happen. What we need to understand is what's going to be the least stressful for the cat, and then make sure that that all happens, either on the floor, on the bench, even on the table, and also where the client is sitting or standing. So I come into the room without having made up my mind about anything.
Take your cues from the cat. Open the carrier door to see if the cat will come out to acclimate on its own. If so, you may proceed. Most examinations will take place on the table of the exam room. If the cat prefers to be held, consider sitting and conducting the examination with the cat in your lap, or on a bench between you and the client. You can also sit on the floor if that's more comfortable for the cat. If the cat's fearful and unwilling to leave the carrier, there are other ways to complete the examination. Remove the top and proceed with the examination while the cat stays in the bottom section of the carrier. Remember to watch for cues that the cat's anxiety may be escalating. If it's still too fearful or stressed, then, while removing the top, slip in a towel over the cat, which gives them comfort and security. With the help of the veterinary team, the cat can then be held while the veterinarian completes the examination. Leave the most stressful items for last. If it's necessary to remove the cat from the bottom of the carrier, do this near the end of the visit.
We were taught in veterinary school to do a physical exam in a specific way, from nose to tail, and to go through a sequence of events in order. We can't do that in cats. We have to adjust our techniques to the demeanor of the cat, to the mood that they're in, and the things that they find difficult to tolerate. And always we want to do the most difficult things at the end.
Veterinary teams should remember to keep an open mind and be flexible during the examination to accommodate the different needs of each cat and client, as well as focus on decreasing the stress associated with the visit.